Alright, guys, so this is some research on United States AIDS most uh, insane member. I'm pretty sure he doesn't work there anymore, but Reimert T. Ravenholt, USAID's population program stalwart. So, this research is just gonna be pretty crazy, honestly. Like, there's a lot to go in with this guy. Anyways, let's get started. As a director of USAID's Office of Population from 1965 to 1979, Reimert T. Ray Ravenholt created a family planning juggernaut that still provokes praise and disdain. Ravenholt was a remarkable leader, full of perplexing contradictions. He dazzled people with his brilliance one moment and shocked them with his myopic ethnocentrism the next. He could be strategically wise and tactically reckless. Ravenholt's controversial reputation masks his many contributions, which are still evident 20 years after he was forced from his leadership of USAID's population program. When Ravenholt took charge of United States' nascent population program, the setting was not auspicious for success. The program had no staff, budget, or mandate. Few developing country governments outside of Asia wanted to do anything with subjects as controversial as population control and family planning. What? Wow. And there was a great debate about whether family planning programs worked. Many doubted the couples would use family planning services, and if couples did use them, that the services would have any impact. But Ravenholt believed that people would use family planning and that it would have a global demographic impact. Ravenholt succeeded in a hostile environment primarily because he considered the word no to be operative only when he used it. If government said no to family planning assistance, Ravenholt got non-government organizations to implement USAID's supported family planning activities. If the physician-dominated health programs did not make family planning easily available, then community-based and social marketing programs would. If couples said no to existing contraceptives, new methods would be developed. Circumventing naysayers was a crusade that all staff were objected to join. If you went to a country that forbade contraceptives, you were to carry two suitcases, one for clothes, the other for contraceptives. Such a tactic led to awkward situations, like explaining to a disbelieving but amused custom official that the suitcase of condoms were for one's personal use. Examples of Ravenholt's legacies abound. In response to governmental indifference to AIDS, donors turned to NGOs, typically family planning NGOs, whose antecedents can be traced to Ravenholt's initiatives to combat the spread of the disease. The World Fertility Survey, which Ravenholt established despite much resistance, has evolved into the Demographic and Health Survey, perhaps the most valuable source for which data on the developing world. Why was Ravenholt relieved of his job after so many accomplishments? Besides ignoring his superiors' direct orders, Ravenholt simply wore out his welcome at USAID. Although much was accomplished, Ravenholt was impatient with the pace of change and became driven by a self-imposed urgency to solve the population problem. But his notion of a population problem, too many people, whose solution was greater availability of voluntary family planning, was dismissed. Yet Ravenholt was unswerving in the certainty of his approach. He had to go. Ravenholt began a program that has devoted $8 billion to population and reproductive health. In 1965, the world's fertility rate was 4.9 children per woman. Today it is 2.9. While today's program differs from his, especially in its emphasis on reproductive health, its programmatic underpinnings remain Ravenholt's. Few people have had more positive impact on the developing world than Reimert Ravenholt. Alright. So this guy isn't all about population control. His existence involves epidemiological things that are like diseases. Like it's actually kind of some of his what he was useful for wasn't just harmful to other people. There's actually a great many things that he probably helped achieve. But unfortunately, great people happen to be pretty terrible at the same time. Like, there were some eugenicists back in the day who, they were pretty smart. I believe Francis Galton, he invented the whole forensic fingerprint thing. So, of course, we're not all thinking of Galton when, thankfully. So, anyways, adventures in epidemiology. Reimert T. Ravenholt, MD, MPH, President, Population Health Imperatives, Seattle, Washington. The study of distributions and determinants of diseases in human population has, during the last half-century, emerged from obscurity into the mainstream of the biological and social sciences. The word epidemic, derived from the Greek words epi and demos, meaning upon people, was during many centuries used to denote the sudden appearance and rapid increase in diverse infections, diseases, influenza, smallpox, the Black Plague, the Black Death of Plague, syphilis, malaria, yellow fever, tuberculosis, cholera, typhoid fever, scarlet fever, diphtheria, polymyelitis, and most recently, acquired immune deficiency syndrome, AIDS. But with the massive increases in mortality from cancers and atherosclerotic and other degenerative diseases of aging during the 20th century, epidemiology was increasingly applied to the study of non-infectious diseases. Today it is applied to the study of occurrence of any disease in the human population. And spoiler alert, unfortunately, human population is also a disease to this guy. Alright. My career in epidemiology began in 1952 when, following graduation from the University of Minnesota Medical School and completion of my internship in U.S. Public Health Service Hospital in San Francisco, I was invited by Dr. Alexander Langmuir to join the Epidemic Intelligence Services of the National Communicable Disease Center, United States Public Health Services, for 2 years of training and service. After the initial training at the CDC in Atlanta, I was assigned to the Ohio State Health Department a year, then to the Seattle King County Health Department, where I served during 8 years. Alright. So, just skipping along, because I don't want to get into too many backstories. So there's so many links to epidemiological information that Ravenholt and Dr. Sammy Lemon were pretty much invested in. So I came across this, and I didn't look at this section necessarily. So I'm just going to scroll slowly because I thought this was super cool. This chronic disease one is pretty crazy. tobacco's death march. That's crazy. But, I mean, it is a killer globally around the world. So, this is the one I mainly focused on. Director, Office of Population, U.S. Agency for International Development, Washington, D.C., 1966 to 1979. World Population Crisis. Challenge and Resolution of Global Humanosis Pandemic. Yo, I bet you some people watching right now are probably like misanthropic and probably think this is actually spot on that humans are a plague. And I used to think this way. I was totally on board with, yeah, humans are fucking nuts. But in my anecdotal evidence, they've always been racist people that say they hate people. They say they hate all people, but they have this niche of specific people they attack, or they use racial slurs for everybody, but they claim that it's neutral. It's just insane. Okay, so I'm not going to go over all these, but there's one that I did want to sort of go over, but I'll go over this slowly so you guys can write it down if you want. I know you can't copy and paste, so that sucks. I thought this was. I'm sorry, I keep saying this, but this is super epic. I could just make my whole channel reading this. This is like so much history. I think it's kind of scary that there's just capitalism just creates the need to have children to create family, which initially was the moneymaker. But we incentivize family down, forcing you to have less kids. And we blame. It's just the blame is just insanity. Like, so many women are blamed for world population. And while it may be a cold truth that at the end of the day, human population comes from women, it's just, while we're engineering the population down, all that money is just getting circulated into the elites. And so it doesn't go into the hands of the people who are struggling. Like, if you're going to erase people, that money should go into the hands of people who are already alive and struggling, but that's not how it works. This is basically like why we need resource allocation. I mean, there's fucking things praising China in this. Alright, so this is an unpublished paper that the Malthusian delusion actually took me to. So, just to get a sense of how this dude talks. Alright, hold on, guys. So, so in Florida that there's this bill that they're trying to make education talk about slavery in a revisionist sense, that it was actually beneficial for slaves and that everything that has happened to them is essentially to their benefit. Psychopaths will pretty much say that. Oklahoma actually recently went against that proposal, so that's some hope. But this right here, what the Florida Board of Education is doing, literally takes after this rhetoric. It's insane. Okay. Africa's population driven catastrophe worsens. The first necessary step to the improvement of any social disorder is an accurate assessment of its causes. Hence, ongoing reticles of colonial era interactions as being mainly responsible for Africa's current agony does Africa no service. While true that Africa's agonies would have seemed less in the world today if Europeans had left Africa untouched and its people had continued in their aboriginal states, uneducated, dependent upon hunting, fishing, and primitive agriculture, with birth and death rates both averaging close to 50 per 1,000 population, maintained in rough balance by innumerable diseases and innocent tribal warfare. It is unlikely that Africans would have been thus content. The ordinary African then lived a short and brutal existence, always threatened by famine and disease, and neighboring tribes. Although the warfare of Tutsis in Rwanda, and by hundreds of other warring tribes throughout sub-Sahara Africa, have obtruded horrific slaughter and maiming scenes upon world broadcast and print media. These activities were common since the time memorial, as they were in Asia, Europe, and Americans until a few centuries ago. Although many American blacks still heap incessant blame upon contemporary white population because earlier white populations owned black slaves, this is an inappropriate onus. Rather, American blacks will more surely reach their full potential when they cease devoting undue time and energy to past difficulties and follow the lead of Booker T. Washington, who made the most of his every opportunity and gained an inspirational, happy, and most honored life. Primitive people have always yearned for the more efficient technologies of advanced peoples, and the main admonition to be made to persons and organizations in advanced nations wishing to help the Africans is first, do the patient no harm. Beware. Do not harm the communities and nations you seek to help with public health programs. Unfortunately, that admonition has often been neglected by those seeking to help the Africans. A main case in point is the powerful interventionist prevention of intent of sorry, the font here is fucking with me. The prevention of infant and child mortality